it's nothing. I've been working out a lot. It's probably a muscle injury, whatever. I'm just going to ignore it. They were all like, oh, yeah, it's a lipoma. Like, totally rare, like 1 in a million chance that we're wrong. So, don't worry about it. The doctor says, well, I took it out and I don't know what it is. It's not a lipoma. It's this hard, pink, flushy thing. It was Myxoid Liposarcoma. And my heart was racing because I knew what it was. So I read it and I just saw cancer, and I went to my husband and I broke down. I'm like, I can't read the rest of this. Like, can you just go through it and tell me what it says? I had been struggling for years with PCOS and endometriosis, both of which for a long time went undiagnosed and had kind of evolved into type 2 diabetes. And this had resulted in a substantial weight gain, and I was over 200 pounds at 5'1". And finally, I had moved to San Diego and I had found the right doctors, and I was able to get my medications right to the point that I was actually able to lose 60 pounds. So kind of leading up to this, it was a lot of tumultuous hormonal issues. And I had come home from a work trip, and I remember I was unpacking and my husband was standing in the closet and he had a mirror outside of it. And I was wearing shorts and I looked down and I noticed a lump in the inside of my right thigh. Immediately, like, my stomach dropped because I've been going through so many health issues, and, I am someone who has a lot of anxiety. I've dealt with a lot of medical invalidation from providers. And so my first instinct was, oh my God, what if this, is something really terrible? But then kind of internalizing some of that invalidation, I was like, oh, it's nothing. I've been working out a lot. It's probably a muscle injury, whatever. I'm just going to ignore it, because the lump had really no symptoms. It wasn't painful. It was just something I could visually identify. And a month went by and I had noticed that the lump had grown. And so it was still firm, hard. I could feel it. I could see it. It wasn't painful. But I thought, you know what? I was off of work for Christmas break and I thought, well, I'll just go to urgent care and get it scanned. I'm sure it's probably a muscle injury and I don't know why it's not healing. So we went to urgent care and the doctor looked at it and he was like, well, let's get an ultrasound. He's like, I really don't think it's a muscle injury. I don't think you caused this, but let's just, get a closer look. And so I'm not worried at all at this point. I'm very heavily convinced this is a muscle injury. So I go and I get the ultrasound and the technician's scanning it, and it's not painful because, again, it's just a hard lump. It doesn't really feel like much. And this technician, I mean, I'm sure a lot of cancer patients can relate to this, looks at their screen and is like, don't leave yet. I need to talk to the radiologist. And it's like, oh, okay. And I had a little panic moment of, oh my gosh, what if it's cancer? Oh my God. Then they ended up, calling me back in and they said, oh no, it's a lipoma, which, if you don't know, is a benign, basically overgrown fat blob. They're like, yeah, they can just be annoying. They can happen sometimes. It's not a big deal. Let's just schedule surgery in a couple months to take it out. At that point, I was like, okay, you know what? Providers have scanned it. They've reviewed it. They told me it's benign and it's a lipoma. So I'm not going to worry about it. So surgery was scheduled for March 23rd of 2026. I went and, did my pre-op appointments and no one was worried. They were like, oh yeah, it's a lipoma, like totally rare, like 1 in a million chance that we're wrong. Surgery was super quick. It was like 40 minutes or something. And I remember we got back in the car and we're driving and he calls my husband and the doctor says, well, I took it out and I don't know what it is. It's not a lipoma. It's this hard, pink, flushy thing. But we'll send it to pathology. You'll hear back next week. It's like, okay. So at this point, I was a little bit worried, but, there were so many more likely benign things that it could have been. So I didn't really worry. But then a week went by and I heard nothing. And then I started to get anxious. And of course, looking up what are all the possible things it could be. And I had read about liposarcoma and things like that. And, but I was like, well, that's so rare. And so I was looking more at like, well, it's probably this type of benign tumor, whatever. Another week goes by and I get a My Chart notification and I'm like, oh, good. Okay, let's see what it is. And I find out they sent the slides of the tumor tissue to like the 5 bone and soft tissue, like cancer experts at the Mayo Clinic across the country from where I was living at the time. And I was like, why would they send it to these people? And so then I was pretty nervous about it. And I went to my post-op appointment and I asked them about it. And I was like, well, okay, you know what? Maybe like that's a very normal second opinion. Like maybe they typically go to Mayo Clinic to have their pathology reviewed, you know, who knows? And I asked like, oh, like, do you guys normally have your tissue samples reviewed? They're like, we've never sent anything there ever from this hospital. I remember it felt a lot like watching a car crash in slow motion. And I was so riddled with anxiety. I think that was probably the worst part of the journey, is just the waiting for what's the implosion gonna be. And it was 2 weeks after that, so it's 4 weeks from the surgery, that I finally get the pathology report that it was Myxoid Liposarcoma. I guess luckily it was the low grade kind, which means that it's not aggressive in its biology. I think I had different phases of devastation and overwhelm with it. I think I'd started with, you know, this was probably the first opportunity, because going through all these health problems like PCOS, endometriosis that primarily affect women, I had dealt with so much medical invalidation, and I really started to doubt myself. And I think what was so disappointing is with this lump and this misdiagnosis, I think it was one of the first times that I actually had initially really trusted my providers because of how confident they all were. The surgeon, the urgent care doctor, the radiologists were all telling me that, you know, it was a lipoma. And I felt comfort in that. And it was the first time I was like, okay, I'm just going to trust these people. I'm not going to worry. And to find out it was something to truly worry about was a lot. I think also once I had the diagnosis and I was researching it, the other difficult part was because it's so rare, it was hard to find other people's stories to understand, you know, from firsthand what that experience is like. But I couldn't find, what does this look like to go through for a human being? And, you know, it's easy to find research papers and I can read all of that. And I think that also kind of set me up for not knowing what to expect in treatment. And then, of course, getting the diagnosis was terrifying and devastating. But I think part of that devastation comes from how cancer is presented in the media. And I think a lot of what cancer looks like is, you know, diagnosis, chemo, bald, dead, right? And that is the reality for so many patients, unfortunately. But what I've come to learn is that cancer, its biology and its treatment is such a broad spectrum that, you know, I didn't really know what to expect if it didn't look like that. So from the studies I was reading, I was like, oh, cool. Okay, it's like a 90% like survival rate and less than 5% chance of recurrence. So I was like, oh, this is like baby nothing cancer. Like this is nothing. Because it is so rare, I had to go to a specialty center. And my options were Mayo Clinic in Minnesota, MD Anderson, and then Sloan, Kettering in New York. And I had family in Minnesota. I was from there, so I initiated care there. And so I had reached out to Mayo Clinic to see, hey, can I transfer my care here? You know, what would you guys take me? And really, I had such a strong moment of patient advocacy because I was so worried that they wouldn't take me. I was across the country. I actually worked with my primary care doctor to write up a letter that just summarized, hey, here's my family history, here's my symptoms, here's my diagnosis. And that letter really helped me get care. So, you know, if any other cancer patients are struggling to get the right providers, I found that was a really helpful strategy. But once I had gotten there, they basically told me, like, so what we're going to have to do is you're going to have to do radiation to the leg. And then we're going to have to, you know, do another surgery to remove the extra tissue. So for sarcomas, essentially they have to remove a very large margin of healthy tissue around it because of, I guess, the way that it can spread and all that locally. But my expectations going into seeing these providers at the Mayo Clinic was, well, you know, they'll probably just take out a little bit more if they do another surgery, and maybe they'll just do radiation and then, you know, chemo or whatever. But I think I really had a realization of, wow, my expectations were wrong when I got there. And he told me, well, we're basically going to have to take your whole inner thigh and, you're going to have to go through radiation first. And then I think what really got me and what's kind of really been haunting me through this journey is that, the study I had read were, 90% survival rate. Well, that was for 5 years. And it goes down every 5 to 10 years. It started very quickly because as soon as I got diagnosed and I got in touch with Mayo Clinic, they're like, we want you here next week and we're going to do 100 million scans. So, I had to basically pack up a suitcase really quickly and fly across the country. And then my husband had to finish packing our whole house and then drive cross country with our pets. So that was a lot for us. And then when I came here, because my parents are about 2 hours away from Mayo Clinic, it was bouncing between here and my in-laws and then, all these hotels. And it was just very unstable to kind of transition into this. We were living a life where I was really growing in my career. I had gone back to school, gotten my MBA. I was doing that while working full time. I had just graduated at the end of 2025 and had a 4.0. And I'm like, this is it. I'm going to get promoted and, we're just going to keep making more money and everything's going to be great. We're going to buy a house. And when I got the diagnosis, I knew it would be a lot. And also, the financial burden of going through something like cancer. And there's like right now, I can't work because the radiation that I received was in such a large part of my tissue that the side effects have been so debilitating that I wouldn't be able to perform. So I was actually part of a clinical trial where they did a lower dose of radiation because I guess my tumor is very sensitive to it. So that was kind of exciting, but it was 18 rounds, but it was in such a large area and basically penetrated my whole thigh that, even though it was less radiation, first of all, it wasn't less compared to other cancers, but it was pretty substantial on the way that it impacted my body. For me, it was, first of all, I was so frustrated because coming into this rare disease and finding that there aren't a lot of options, and the only way that they can build more options for patients is through clinical trials and through, opting into research. So I was actually asked if I wanted to participate in a study, first of all, for the lower radiation, and then it's like a bio banking. Basically, I donate my the tissue. So once they're done taking everything out from my next surgery, and it goes through pathology and everything, it'll go directly to research. So those researchers can go and, use all of my tissue there. I also donate my blood every 3 or 4 months. So basically giving parts of my body to them. But for me, it never bothered me and it never crossed my mind not to participate because I knew how stressful it was to have a diagnosis of something rare without a lot of data and without a lot of treatments available. And how if I could do anything to help that, I would. Nobody talks about radiation. I thought it was like nothing. All I heard was, you might get a sunburn and you don't feel anything when the machine's going. That's all I knew. And so going into it, I was really unprepared. And I remember my first session, I really just expected it to be like nothing. I had this cast, this kind of mold they made to place my legs in every day. So they're lining me up and they're getting the machine going. And then, they leave you in this room and, thank God I had them play Taylor Swift for me, obviously. But, it was really scary. I think it was the first time it hit me that this is cancer treatment. They don't just do this to everybody. It's kind of claustrophobic. You can't move. You have this giant machine moving around you. It's, making loud sounds and that in itself is very overwhelming. And one thing I was very grateful that I was able to ask for was, at first I was embarrassed about it. But I told my care team what was going on and they prescribed me a short course of Ativan during treatment. And that really helped me get through it without the panic attacks and without the PTSD. So That was huge. But yeah, it was really an adjustment. Over time, I got more used to it during the sessions and like, okay, this is my routine now. But as it went on, like the fatigue was crazy. It would just kind of hit me all of a sudden and I would just go down. And then I would kind of recover and then I'd have a day where I was high energy. I was able to walk a lot and exercise and felt very lively. And then, of course, as treatment went on, those days became more and more spaced out. And then, of course, changes to the tissue. So, my inner thigh became a lot more stiff and firm, kind of like if I touch it, it reminds me of like an overcooked steak, which sounds kind of nasty, but that's kind of the way that I guess the tissue kind of changes with the radiation. So luckily, I didn't really get too bad of a burn because I was very diligent with the skincare that they provided me, which was lotion and Aquaphor. But I had a lot of soreness. I started to develop a limp about halfway
Mhm.
through. I'm actually having my surgery on July 10th of 2026. So historically, they used to do amputations to treat this disease. But now they have what's called limb salvage surgery, where basically they will take a large part of the tissue of the limb and they can plug in muscles from other parts of the body or, whatever, and basically reconstruct it to be a functional limb without fully having to take it, which is very extensive. So my tumor was 3.5 centimeters in pathology, but because it's a sarcoma and they have to remove so much tissue, they're going to be taking out tissue about the size of a football from my inner thigh. So I don't know exactly what they're going to be doing, but from at least what I understand, there's going to be the orthopedic surgeon who will come in and he's going to take out the tissue, do the removal. There's going to be a team of plastic surgeons who are going to come in and basically reconstruct the leg. I don't know exactly what that's going to look like, but basically their job is to make it functional and make it not look like a shark bite. So that team is going to be working really hard to do that. And then, of course, the research team is going to be there to collect some tissues. So yeah, it'll be a whole thing. I think it can go between 9 and 12 hours. I will not be able to drive for a long time. I'm going to have to relearn how to walk. They said that the first 3 months is going to be very intensive rehab. And then it's going to be 2 years to fully regain a sense of normal-ish mobility. So knowing that I'm probably not going to be able to walk around by myself for a long time, I'm probably going to struggle to do basic things for myself for a long time. I don't know fully what the obstacles I'm going to experience are going to be. I haven't fully grieved the loss of my mobility yet and what that means and what that looks like. If I look at who I was a year ago, I was someone who was working out 2 hours a day. I was traveling all across the country for work on my own. I was the breadwinner. I was finishing my master's degree. And I've always been someone where I'm very driven. I always want to be able to feed myself, I don't want to have to rely on anyone for anything, for any reason. But of course, as humans, that's not how we evolved, and that's not healthy for us either, and I get very defiant when people want to try to help me, and I've been having to learn not to do that and to learn to, let my husband do some of the physical stuff around the house and, because I've been so independent. So I think it's hard, but learning to make space for other people to be there for us. And I think also that, truly reciprocal and loving, healthy relationships are not transactional. And what I mean by that is, real life is not always 50-50. Sometimes it's 20-80. Sometimes it's 40-60. Sometimes it's 80-20, right? And this is just a period of my life where I'm needing to receive more, but that doesn't mean there aren't going to be periods of my life where I'm not being able to give more. So reaching out, asking for help. I'd also say reconnecting with old friends has been really helpful. People from high school and People who really know me, that make me feel seen are really helpful. And also support groups, reaching out online, talking to other people with my disease, or other young adults with cancer. I didn't know when I was diagnosed that the majority of cancer patients are over the age of 50. And walking into every waiting room and being the youngest person there, and I'm not going through chemo and I have all my hair, and people just kind of staring at me, was a jarring experience as well. So finding other people who I can relate to has also been very helpful. It was hard for me at first because, you have this idea what a cancer patient is. And if you don't look like that, well, are you really doing that bad? Is your disease really, that traumatic and that difficult and that scary if you don't look like a cancer patient? I think this experience has taught me that cancer is a spectrum, and how someone looks isn't necessarily a reflection of, the severity of the disease. I think it's also empowered me to want to connect with other people and share my story to educate others that cancer doesn't look one certain way. And the treatments and the severity of the treatments and how the treatments look is dependent on the biology of the cancer, and not necessarily a reflection of how well someone's doing or how good their odds are. And I think making space for that and being an example of someone going through cancer, that is a rare disease and that is really scary. And I do still look like this. I hope that helps people be more aware of, you really don't know someone's health just by looking at them. I would say my biggest piece of advice is validate yourself. What you're experiencing is real. What you're experiencing is horrifying. There is no good cancer. All cancers are bad cancers. Please give yourself the kindness and the space and the compassion to feel every feeling that comes with that. One thing that's helpful for me is listening to music, sad music, happy music, energetic music. And for me, that's a way to express my feelings and to connect with them, and finding those ways for yourself. I think cancer is in some ways more difficult emotionally than it is physically. And don't let anyone ever tell you any nonsense like, oh, it's not that bad, or so-and-so has it worse, or, don't let anyone externally invalidate you. What you're going through is very real, and give yourself the space for that. You are your biggest advocate. When something is wrong with your body. Don't ever let anyone, no matter what their profession or their certification is, tell you otherwise, because you live in your body. And I would also say, if you're going into an appointment, do not let your priority be the comfort and happiness of your doctor. Your priority is your care. And if you advocate for yourself and maybe you upset them or you piss them off, that is not your problem and that is not your responsibility.